Hi viewers, welcome back. Today we are going to do part 7 of Human Health and Diseases, which is a part of the 12th CBSE syllabus. And today in this part 7 we are going to deal with cancer. So from the aspect of NEET, what are the questions that you can expect from this part? Exclusively cancer. You can get questions like on the types of tumor. Now you have malignant, benign tumor. Then you can have questions from the therapy. Okay, the therapy is a chemotherapy, so you can have questions from these areas. So today, before we get started, let's discuss few points of what is this cancer. So basically, cancer is said to be non-communicable or non-contagious disease or non-contagious. It doesn't spread from a person to person. We all know that, right? It doesn't spread from person to person. If a person is infected in a family, it doesn't mean the others will also get this. So what is this cancer? Cancer can be defined as an uncontrolled growth of abnormal cells anywhere in the body. So it is not prescribed. It will only come in the skin, or it will only come in the breast, nothing like that, right? So before we go here, actually, as per research, as of now you have more than 200 types of cancer, they say. So see the rate. So this is becoming a threat in many developing countries because people are much prone to this disease. So we're going to see the definition of cancer first. Cancer is a disease that involves heritable defects in the cellular control mechanism that result in the formation of invasive tumors capable of releasing cells, and that can spread the disease to the distant sites in the body. As I already said, it is an uncontrolled growth of abnormal cells irrespective of any part. Anything that may cause a normal body to develop abnormally potentially can cause cancer. General categories of cancer related or causative agents can include chemicals or toxic compounds, exposure to ionizing radiations, some pathogens, even human genetics are involved in this cancer, they say. So tumor, if you see, they are of two types. One is benign and the other is malignant. So when I say benign tumors, they normally remain confined to the original location. That is, they do not spread. They are confined to the original location and they do not spread to the other parts of the body, and they cause very little damage. But when I say malignant tumors, on the other hand, they are a mass of proliferating cells. That is, the cells differentiate at a rapid rate, and they called as neoplastic or tumor cells, and malignant tumor is associated with cancer. So when we talk about this cancer, as I already said, there are more than 200 types of cancer so far identified types. So it can be lung cancer, it can be pelvic, then it can be breast cancer. You have many different types. So it is not confined to a particular region, or if it is not prescribed to a particular part of a body. So malignant tumors, on the other hand, they are a mass of proliferating or differentiating cells which grow at a very rapid rate, and they are also called as neoplastic or tumor cells. So before we go into detail, they say that cancer is the leading cause of death worldwide. It is accounted for about 8.2% or 8.2 million deaths around. That is, it is about 22% of the death not related to communicable diseases, and this data was received from WHO. Okay, so now we'll go into detail. So cancer has 4 important characteristics. What are the 4 important characteristics? Uncontrolled cell growth. The cell multiplies rapidly. Loss of cell differentiation, there's no specialization there. Invasion of the normal tissues. Metastasis, that is, spreads to the multiple sites. It's not confined to a particular organ or a tissue. It starts multiplying and reaches the distant organs and tissues. So what are the symptoms of cancer? What are the symptoms or common symptoms of cancer? So it's the change in the bowel and the bladder function. A sore throat does not heal. Unusual bleeding or discharge, thickening or lump in any tissue, indigestion or difficult in swallowing. Cancer symptoms and signs depend on the specific type and the grade of cancer. Yes, as I already mentioned, there are more than 200 types of cancer, and the symptoms will, so these are the common symptoms for every anybody who has cancer, but there are much more symptoms which are confined to a particular type. So they depend upon the type and the grade of cancer. Although general signs and symptoms are not very specific, the following that I mentioned here, the change in the bowel or the bladder function, the sore throat, weight loss, apart from that you can also add here weight loss, then you have pain, skin changes, bladder function, unusual bleeding, persistent cough, voice change, then you'll have lumps in the body. In any unusual area you will find lumps. So these are the common symptoms here. Okay, so now we will see what are the causes of cancer, what are the reasons why we get cancer. So what causes cancer? Cancer is caused by accumulated damage to genes. Such changes may be due to the change or the exposure to cancer causing substances. So the first one that is mentioned here is transformation of the normal cells into cancerous neoplastic cells may be induced with the help of physical, chemical or biological agents, and these agents are called as carcinogens. The substance that causes cancer, to make it simple, you can just remember the substance which causes cancer are called as carcinogens. That's a scientific name given here. A carcinogen can either be a physical substance, chemical substance or a biological substance. Right? When I say chemical substance, we can include the molecules that are present in the tobacco smoke. That is an example for chemical carcinogen. And the cause of the cause of cancer may be environmental or other genetic factors that is associated with the person. And we also have to remember that biological and internal factors are also associated with cancer. So what are they? So what all will come under it? They include age. Internal factor, so under internal factor you'll have age one, other it might be gender, then you have any skin defect, or it can be associated even with a genetic defect. They say skin type also plays an important role in getting cancer. Apart from that, you have ionizing radiations like X-rays, gamma rays, and non-ionizing radiance like UV rays, DNA damage leading to neoplastic transformation. So when we have too much of exposure to UV rays, so that is environmental exposure for us. The instance to the random and the UV radiations and fine particulate matter will come under this. Occupational risk factors including carcinogens and many chemicals and radioactive materials which are mixed in air, right? That is also associated with cancer, a research says. Apart from that, they also say that lifestyle related factors. So a chemical carcinogen, the example is given here, the tobacco smoke. When you start inhaling, the person who's smoking is less prone to it, but the person who is inhaling the smoke is highly prone to cancer. Cancer causing viruses are simply called as oncogenes, and they have genes called as viral oncogenes. So let's discuss few points about oncogenes. So what are these oncogenes? The cancer causing viruses are called as oncogenes. Viral oncogenes, commonly known as cancer genes, are genes which encode proteins triggering the transformation of the normal cell into cancer cell. Oncogenes are not essential for the replication of virus, and mutants lacking them which will replicate normally without being oncogenic. So what happens here? Genes that are closely resembling viral oncogenes are found in the normal cells as well as cancer cells. Oncogenes isolated from cancer cells are called as cellular oncogenes, and similar genes that are found in the normal cells, that is, normal cells also have oncogenes and cancerous cells also have oncogenes. That is what they are trying to bring in here. So the one which is found or isolated from the cancerous cell, the oncogenes that are isolated from the cancerous cells are called as cellular oncogenes, and the one which is isolated from the normal cells, the oncogenes which are isolated from the normal cells, they are called as proto-oncogenes. They are not viral in origin. Which is not viral in origin? The proto-oncogenes. On the contrary, viral oncogenes appear to be the host cell origin. Cellular oncogenes may contain intron characteristic of eukaryotic genes, while viral oncogenes do not. So these are something that I would like to discuss here. And few points about proto-oncogenes which are not, kind of threat. It's a widespread in vertebrates and other, especially when we talk about human beings to fruit flies. All the vertebrates are associated with this proto-oncogenes. We all have it naturally in our body. They are well conserved in their genomes, suggesting that they have been found to code proteins which are involved in regulating cell growth and differentiation. So one thing to be clear here is all of us have oncogenes naturally in our body, but there is a situation, as I already said, these factors that are mentioned here, the causes of cancer, they act as a triggering factor which trigger out these proto-oncogenes to get converted into cellular oncogenes. So as I said, internal factors also play a major role when it comes to causes of cancer, like age, gender. Female, if you see, once they undergo menopause, they are prone to cancer because they don't have the hormones like the female sex hormones which you have, progesterone and estrogen, which will stop secreting after menopause. These hormones play a vital role in maintaining and survival of the female. They help in many more functions. They say they give you a good immune response. A person remains in good immunity power. The person is prevented or protected from cancer. But once the female undergoes menopause, it becomes a threat to her side. So these are also factors which help in converting in the proto-oncogenes into cellular oncogenes. They have been, so as I said, these proto-oncogenes that is naturally present in us, they encode proteins for cell growth and differentiation. Only when that conversion of this proto to cellular takes place, the cell differentiation goes in a rapid rate and that becomes tumor cells, right? The pre-assumed functions of many oncogenes have been identified so far, and you have many. So the list is big. Okay, now let's move to the next part here. So the development of cancer we are going to see in this part. So what is said here? Cancer develops through a process that can be divided into 3 stages. Okay, 3 stages. So first is initiation. So it's just the onset of a disease. Mutations means sudden change. Right? Mutation is a sudden change. Mutation in proto-oncogenes, which are normal cells. Kindly remember this. You might have questions from this because you should know to identify between cellular and proto. Cellular oncogenes are cancer genes, while proto-oncogenes are normal genes that are present in our body, and they are said to help in coding for cell differentiation and multiplication and growth. So here if you see, the mutation in the proto-oncogenes and in tumor suppressor genes may be inherited, or they can be caused by viruses. As I already said, the factors like radiations, age, gender, all these factors seem to be triggering your proto-oncogenes to get converted into cellular oncogenes. Sometimes certain viruses, chemicals or radiations do this work. These mutagenic agents are referred to as initiators, and the process starts with initiation. That is why the process is called as initiation. Now the proto-oncogene is initiated and triggered and is getting converted into cellular oncogene. Next is promotion. It is a process by which the initiated cells are stimulated to grow. What is cancer? It is an uncontrolled growth, right? The cells will start multiplying very rapidly. So here it stimulates the growth and they start dividing or multiplying at a rapid rate. The cells in the early stage of promotion may grow and divide abnormally. That is what is called as cancer. The normal cells becoming abnormal. See, multiplication and growth is not sufficient for the person or for any organism throughout. Okay, so this forming a benign non-cancerous tumor. Okay, next is progression. So you find progress in that. Okay, you find the progress there. During this stage, the transformed cells usually become less differentiated than benign cells and increase their rate of growth and division. They have the ability to invade and kill other tissues and also metastasize, that is, they spread to the other distant organs and tissues, and they also start spreading to the other parts of your body. Tumors are made up of cells with these properties, which are malignant, which have the capacity of unlimited and rapid proliferation. These proliferating cells are neoplastic. So here you have the process, which is given in the form of pictorial representation. So initiation. So when I say initiation, it's a mutagenic agents, which is inherited factors. So the factors which initiate can be either viruses, or it can be a microorganism, chemical, or radiation. So they are called as initiators. Next is promotion. Mutagenic agents, like as I mentioned here, they promote the cell growth. They stimulate. Very, very important. They stimulate the cell growth. And later, first at the very beginning stage, immediately it doesn't become malignant. It begins with benign, because benign is also a form of tumor where you have uncontrolled growth. But slowly, when this benign is left untreated, or you don't care of what is happening in yourself, there are a lot of chances for you to get that converted into malignant. One thing you need to remember here is, whenever you get tumor in unusual places of your body, it is always good to go for a checkup, because these tumors, cancer tumors, usually occur in unusual places of our body. So next is the last stage, which is progression, where the disease, where the growth progresses to the next level and it gets converted into malignant. Now we are moving on to the types of cancer. Actually, as I already mentioned, there are more than 200 types of cancer, but now we will discuss the common ones and most prominent ones. So the first one, if you see it, it is carcinoma. Okay, it originates from the epithelial cells. 85% of the total cancers are carcinoma. Next is sarcoma. It's a malignant tumor of connective tissue. Kindly make a note of it so that you don't have to miss anything. Carcinoma originates from epithelial cell. Sarcoma, it's a malignant tumor and associated with connective tissue, and they constitute about 2% of total cancer. But if you take carcinoma, which is 85%. Leukemia, and this is mostly prevalent in children. It is a malignant tumor of stem cells. What are stem cells? Undifferentiated cells of homeopoietic tissues, and they constitute about 4% of total cancer. Then you have lymphoma. It is a malignant tumor of secondary lymphoid organs. So what are the secondary lymphoid organs that we studied? Tonsils, spleen, right? You remember we studied all this. So these organs get affected here, such as spleen and lymph nodes. 4% of the reported cancers are mostly lymphoma. Next is myeloma. Here cancerous growth is of plasma cells, a type of white blood cell made up in the bone marrow. So these are the 5 different types of cancer which are more prominent and found worldwide. Next we have the diagnostic measures. How can we detect if someone has cancer? Right? It's very important. Any disease, any disorder, we go for a diagnostic measure. We need to identify what is it, because the treatment has to be specific, right? The treatment has to be a specific treatment. You cannot give generalized treatment. So cancer detection is based on biopsy. So they will have a biopsy done and they will check in how the growth of the cell is, or histopathological studies of the tissue and the blood and the bone marrow test. So if you know, cancer cells, they grow very rapidly, right? So this is one diagnostic measure that you can do. So when they isolate and they start growing it under in vitro conditions, they can see how rapidly they are growing and they can tell you what is the situation. Next, in biopsy, a piece of suspected tissue is cut into thin sections, is stained and examined under microscope by the pathologist, the one who works in the lab. And next is computer tomography, which is called as CT, and uses X-rays to generate the 3-dimensional image of the internals of an object. So we are viewing it. Next, we go for an MRI, which is called as magnetic resonance imaging, and this uses a strong magnetic field and non-ionizing radiations like UV rays to accurately detect the pathological and physiological changes in the living tissue. So this process, to get the result, it might take even 2 weeks for us to come in. So this is a cancer detection and diagnostic measure that we carry out. So this is the most relevant method for diagnosing cancer, and this is called as imaging test that is used for diagnosing cancer that we saw here. One is CT and the other is MRI, and sometimes you even go for PET. You must have heard about it. This is another technology here which is called as PET, and the full form of this is positron emission tomography. Okay, emission tomography. This is also an imaging test to diagnose cancer. Okay, and you also have ultrasound and X-ray to detect this, and the most relevant or the most accurate method is biopsy. But okay, the doctor will collect the sample of the cells and they test it under in vitro condition. So this is how we diagnose and detect cancer. Next is the treatment of cancer. So how can you treat cancer? How can you kill those differentiating cells which are growing at a rapid rate? So first we say radiotherapy. So what do you do in radiotherapy? In radiotherapy, the tumor cells are irradiated lethally, taking proper care of the normal tissue surrounding the tumor mass. So one thing the person has to be careful, the person who's giving in radiation for the person who has cancer, they only should start destroying the tumor cells, not the normal cells. Next is chemotherapy. It involves treatment with anti-cancer drugs. However, there may be side effects leading to hair loss. You must have seen people who are experiencing this particular dreadful disease. Once they start or once they go in for chemotherapy, they automatically their hair, it will end up in great loss. But the condition is not that it's going to be throughout. Once they recover, the hair will start growing again. So this is just a side effect because of the drugs that they take in. Next is surgery. Preliminary goal of the surgery is to remove either the tumor or the entire organ which is affected. Next is immunotherapy. The proteins encoded by the oncogenes are inhibited. As I already said, our body naturally has oncogenes in our body in the form of proto-oncogenes. And what is the work of it? It encodes protein which help in cell differentiation and growth. So what will they do? Once this is converted into malignant or cancer genes, they will start inhibiting the proteins which are encoding for this. So this is one method that they follow. It induces the patient's own immune system to fight the tumor. So they are helping an inborn system so that they can help the patient. And that is alpha interferon, and that can be used to activate your immune system. Okay, so this 4 that I mentioned here are effective methods for treating cancer. So with this we complete the part 7 of cancer, and hope to meet you in the next part with another set of explanations and discussions. Thank you and all the best.